Hi, everybody.
Hi, everyone. Our presentation is on urinary tract infection. We're going to be talking about preventing and identifying UTIs. Our presenters are Janine, Michelle, Reshma, Angela, and Nicole. We chose UTIs because working in healthcare, we see urinary tract infections frequently in seniors. Go ahead, Nicole.
One of the many unseen, hard to detect dangers that senior citizens face today is urinary tract infections, more often known as UTIs. The symptoms of UTIs in the elderly can often mimic those of other more serious conditions like dementia. Given that UTIs are one of the most frequent hidden infections seniors suffer from, it is important to be able to differentiate them from other illnesses. With this presentation, we will go over resources to diagnose, manage, and prevent UTIs in the older population. The primary goal of educating the elderly population about what symptoms to watch for, when to seek help, how they can help others, consequences if left untreated, what to expect when you see the doctor, and treatment options available. Next slide.
Parts of the urinary tract system. We are looking at images of the male urinary system and the female urinary system. It's a side view of the urinary tract system on a male and a female, and their anatomical landmarks. One thing to note, we can see that the female has a shorter urethra, which we speak to later in the presentation as having an effect on UTIs in females. Urinary system anatomy and function. The body takes what it needs from food and changes it into energy. After this, waste products are left behind in the bowel and in the blood. The urinary system keeps everything in balance by removing waste like urea, extra salt, extra water, and other things the body does not need. The kidneys. There are a pair of kidneys located below the ribs in the middle of the back. Their function is to remove waste from the blood in the form of urine, keep substances stable in the blood, make erythropoietin, a hormone which helps make red blood cells, makes vitamin D active, regulates blood pressure. The kidneys remove waste from the blood through tiny filtering units called nephrons. The renal tubule drains urine and joins other tubules, carrying the urine out of the kidney to the ureter. Urea together with water and other waste form the urine. The two ureters, each kidney has a narrow tube called a ureter, which carries urine from the kidney to the bladder. Urine travels down the tube away from the kidney. If urine backs up or stands still, a kidney infection can develop. The bladder, it's a triangular shaped hollow organ in the lower abdomen. The bladder stores urine. It contracts and flattens to empty urine through the urethra. The urethra, the tube that allows urine to pass outside the body. The brain signals the bladder muscles to tighten, which in turn squeezes urine out of the bladder. And at the same time, the brain signals the sphincter muscle to relax to let urine exit the bladder through the urethra. It's important to note that when all the signals occur in the correct order, normal urination occurs. Next.
Okay, so what is a urinary tract infection? So a UTI is an infection somewhere in the urinary tract system. This could be in the bladder, the ureters, the kidneys, or the urethra. Most commonly, this infection affects the bladder and the urethra. The bladder stores and collects urine from the ureters and the kidneys, and that the urethra that carries the urine out of the body is where infections most commonly will take place. These infections in the bladder and in the urethra can lead to infections into the kidneys as well. Though UTIs are very common, it is important to take them very seriously. Next slide, please. So bacteria lives why do we get UTI? So bacteria lives in the vagina, in the genital area, rectal areas, and that bacteria can enter the body through that exit, through that urethra where the urine comes out. So for example, sexual activities, bacteria can get in from other partners' genitalia, their fingers, sex toys, anything like that can introduce bacteria into the urinary tract that way, among many others that will be discussed a little bit later. So really, who is at risk for urinary tract infections? Mostly females. Due to the anatomy of women, it is easy for women to get UTI. The urethra, that exit, is shorter, making it a shorter distance for the bacteria to travel to make it into the bladder. People that have a history of UTIs is another big reason. Men with large prostates, but not all men with enlarged prostates will get a UTI, but it's a risk. Men with enlarged prostates have a hard time emptying their bladder. If you look at the image that's on the computer, the image on the left side is a normal prostate. That tube going through that yellow part of that picture is a normal urethra with good flow. The one on the right side, as you can see, it looks more compressed, kind of like putting a kink in the hose. It makes it more challenging for the urine to get through the urethra. So what happens is the bladder doesn't empty all the way. Bacteria starts to build in that stagnant urine that can't empty out of the bladder, and thus can lead to an infection. So it just sits idle, that bacteria grows, and it can end up being a serious problem. Another risk could be diabetes, autoimmune disorders. People with diabetes have restricted circulation through the body. So white blood cells, those little warriors that fight infection inside our body, they can't make it to the area of the infection, and it can't help you fight the UTI. People with a history of kidney stones. Kidney stones can block the ureters. The ureter is that spaghetti string that Reshma described to you earlier that goes from the kidneys into the bladder. And when that gets blocked, that fluid, the waste, the urine, all the stuff your body's trying to get rid of, gets stuck and starts to build and stays in your kidneys, which can lead to a more serious infection, such as being septic. Individuals that share sexual partners, as mentioned before, can be a risk factor. And now that we know what urinary tract infection is and who's at risk, let's discuss the symptoms. Next slide.
So there are many symptoms of a urinary tract infection. You can have increased pain, burning, blood, increase in your urination. You can have an increase or new amount of your incontinence if you did have some before. You might feel the need to urinate, but it doesn't always come out. That's urinary retention. You could have some bladder spasms, pressure and cramping in the lower abdomen. And you could also have some mental status changes, some new confusion or worsening confusion. So if you notice a change also in the smell or the color of your urine, it could warrant a trip to your primary physician. Next slide, please. So when to see your doctor? Like we just said, the change in the smell, the color, frequency. You could have pain, the burning, all the symptoms. If you have mental status changes, that's kind of a frequent symptom. Sometimes people might think, oh, you just didn't sleep good the night before or something, but sometimes a UTI, especially in the older population, could be the mental status changes. Fever, nausea, vomiting, those are all symptoms of a UTI. So if you have a buddy, it would be nice if they could let you know if you're acting a little off. Next.
Okay, what to expect when you visit your physician. When you go to the doctors, you should report any symptoms that you have been having. Make sure to include symptoms such as increased confusion and any recent falls. The doctor will usually perform a physical exam. Your physician may ask for a urine specimen. The office professionals can explain how to provide a clean catch urine specimen when you're there. If you have had frequent symptomatic urinary tract infections, the doctor may order an imaging test such as a CAT scan. Another possibility is the doctor could refer you to a specialist called a urologist who uses a cystoscope to get a better look at the urinary tract system. And your doctor may prescribe antibiotics. Next slide, Ann, please. If you are prescribed antibiotics, it's important to take your full prescription of the antibiotic, even if you start feeling better. And it's very important not to share antibiotics or save them for later. Finish the report any symptoms such as rash, itching to your doctor. Also follow directions of the pharmacy staff, such as drinking enough fluid. Number 10. Thank you. There are a number of things you can do to prevent urinary tract infections. Some of these include staying hydrated, use of powders or sprays in the genital area should be avoided. Women should avoid taking baths, void after sex. If you use incontinence diapers or pads, change them frequently. Additionally, women should wipe front to back to keep bacteria further away from the urethra and additionally avoid alcohol and caffeine. They can dehydrate you. I think that's it. Next.
So as people age, they lose certain abilities to care for themselves that we take for granted. Educating this population, they don't usually present with typical signs and symptoms of infection and can aid in treating them correctly. By taking preventative measures to protect the elder population against urinary tract infections, it's vital to maintaining their health. These are resources that we found that are available to use. There's links in the comments there. Thank you for your time, and please look through these references that are provided for further information. Any questions or concerns, please let us know, and thanks again for your attention.